When patients need isolated mitral valve repair, this can almost always be done through a limited incision through the right side of the chest between the ribs rather than through the breastbone with traditional open heart surgery. The limited incision right chest approach is called minimally invasive mitral valve repair and can be done with a video camera or with a robotic technique depending on the patient's needs. This technique allows the patient faster recovery, shorter length of stay, fewer complications, and a much faster return to work and normal activities. Because we don't divide the breastbone, there's no lifting restrictions or driving restrictions following surgery as with traditional open heart surgery. Not every patient qualifies for a minimally invasive approach. The main criteria are only isolated mitral valve disease or irregular heart rhythms that need to be addressed. Patients that need coronary artery bypass grafting or other surgery need to have traditional surgery. If only the mitral valve or an irregular heart rhythm is being addressed, then a minimally invasive approach is suitable. In this situation, the patient will have one or two very small incisions on the side of the chest, typically just below into the side of the nipple, and a small incision in the groin where we would connect the heart-lung machine. A video camera would be used to see inside the heart, and then we would repair the valve using long instruments or a robot. Once the valve repair was complete, a single drain would be placed in the side of the chest on the right, and the incisions would be closed. The incisions are typically about 2 to 3 finger breadths in size and do not involve spreading or opening of the rib cage. This type of procedure is typically associated with a very short hospital stay, about 3 to 4 days following surgery, and a much faster recovery, with most people returning to normal activity in 2 to 4 weeks. The complications following this are much fewer, with fewer blood transfusions, fewer irregular heart rhythms, fewer infections, and overall very high repair rate of almost 95% in most series. I have been doing minimally invasive mitral valve repair for over 10 years and have performed approximately 500 in my career. We traditionally do about 60 minimally invasive mitral valve operations a year. In my experience, the mitral valve repair rate has been approximately 97%, and we have had 1% or less mortality or major complications with the procedure. With respect to minimally invasive cardiac surgery, we here at CTSA do more minimally invasive cardiac surgery than anybody in the Rocky Mountain region. We offer both minimally invasive mitral valve surgery, minimally invasive aortic valve surgery, minimally invasive coronary artery bypass grafting, minimally invasive atrial fibrillation surgery, as well as removal of tumors and other things that can affect the heart less commonly.